1 in 4 of the LGBTQ community in America experience discrimination in a clinical setting, causing 1 in 5 to avoid care throughout their entire lives. 1 in 6 are denied care, as I was, and 1 in 8 live in states where providers can legally deny care to anybody they don't want to, particularly LGBTQ citizens, based on their religious beliefs. Hi, everyone. My name is Justin Ayars. I'm the founder and CEO of equalityMD, and I'm thrilled and tickled pink to tell you about our story. This was me 6 years ago. I went to a Washington, D.C. dermatologist to get my whiter than paper skin taken a look at because I was concerned about skin issues like melanoma. The doctor walked in and I was wearing one of these awful hospital gowns, which nobody likes. And when I came out as gay, he said he couldn't complete the exam because he did not feel comfortable touching my skin because of my sexual orientation. He walked out of the room, leaving me feeling alone and ashamed. Sadly, this is not uncommon. 1 in 4 of the LGBTQ community in America experience discrimination in a clinical setting, causing 1 in 5 to avoid care throughout their entire lives. 1 in 6 are denied care, as I was, and 1 in 8 live in states where providers can legally deny care to anybody they don't want to, particularly LGBTQ citizens, based on their religious beliefs. Importantly, because we're an invisible patient population, not all of us want to raise our hand and be counted. It's the most undermeasured patient population in the country. Without information about the patient journey data, health systems, payers, and corporations are not able to make data-driven informed healthcare and business decisions. We're creating an LGBTQ inclusive virtual first platform that also measures data analytics. We start by using evidence-based cultural competency training to educate mental health and primary care providers how to treat LGBTQ patients in a safe space. Our machine learning matching algorithm functions much like a dating app, and its patients are matched with providers based on their unique personal identities and preferences. Over time, we'll be collecting new data insights about this undermeasured patient population and sell those actionable insights to health systems, payers, and corporations so they can make decisions that really help this community get the care they deserve. Much like the California Healthcare Foundation's mission, our mission is to deliver care to a growing underserved community, a community where 72% experience financial stress, 56% don't think they can afford healthcare at all. And sadly, 1/3 of our elders community live at or below 200% of the federal poverty level. We are improving access for this underserved community. We're hyper patient focused, and our tech solution is interoperable. Jose comes in and creates an account as a new patient, say he's an employee at Capital One. He would complete an inclusive intake form that collects SOGI data, sexual orientation, gender identity, social determinants of health, and all types of questions that really dive into who he is as a person and the intersectionality of his unique identities. His personalized dashboard gives him access to virtual and in-person appointments, medications, and community events. All virtual telehealth sessions take place within our platform. Jose's matched with providers based on the inputs he gave during his intake process. Again, much like a dating app. He can always filter through and change providers based on what his current medical needs are, or should his identities change, he can update that at any time for any reason. Providers are given what we call equality scores, and those are metrics that we compile based on how many courses providers take through our educational cultural competency platform, but also on patient feedback. Our business model is B2B to C for health systems and payers and employers. We're helping health systems and payers increase patient engagement, resulting in better patient outcomes, and we're helping employers create an inclusive healthcare benefit platform that attracts and retains the best and brightest, most diverse talent. In 2021, PitchBook declared the LGBTQ healthcare market to be valued at $216 billion and growing as more and more young people are increasingly coming out. There are about 30 million LGBTQ Americans in the United States, and our serviceable obtainable market is valued at about $8 billion with our single go-to-market partner. The biggest one is the National LGBTQ Chamber of Commerce. After forming the company in 2020, we raised some money, found some good partnerships, and built an MVP that had paying patients and providers coming on, and they gave us some great feedback, which allowed us to make some changes and evolve into the company we are today. As we complete the Cedars-Sinai Accelerator in 2 weeks at the Health Conference in Las Vegas, we're going to be able to start some pilot programs with health systems and payers early next year, selling to small, mid-sized businesses and enterprise clients that we've known the supplier diversity and procurement people for many years now. So we already have those relationships established. All these competitors They all do great work. I won't lie about that. But none of them have everything that we do in one single interoperable platform. Evidence-based training, machine learning, matching, and it's a virtual first platform, not just telehealth, and we serve all LGBTQ patients. We're the right team to do this at the right time because we have lived the problem we're solving. We're helping all LGBTQ patients become the superhero of their own healthcare story, giving them access to care, agency, dignity, and respect. Thank you for your time, and I very much look forward to your questions.
Many companies, health systems, and nonprofits say that they have hundreds or thousands or more medical providers in their networks who are LGBTQ friendly or have served LGBTQ patients. What makes Equality MD different when it comes to having a network of inclusive providers who've completed your specific cultural competency training?
I love this question, Jamie. It's probably I used to be a healthcare defense litigator defending insurance companies. So I ask, what what does LGBTQ friendly mean? Uh, I I don't know, but existing entities out there all have good intentions, but they're literally checking a box saying I'm gay friendly, LGBT friendly. I've served LGBT patients, but even LGBTQ providers can provide awful service to LGBTQ patients, whether it's they're too scientifically minded, don't have the right bedside manner. And it's important that we use the highest evidence-based scientific methods of teaching, and we get those from the Fenway Institute's National LGBTQ Health Education Center, which is the gold standard. There's also the ability for those providers that go through our training to get CME credits. And we're the only ones that have that evidence-based training, and that really excites me.
If I'm remembering correctly, back in the 2016-17 timeframe, the National Institutes of Health declared the LGBTQ community to be a health disparity population. Why was it necessary to do that?
The NIH has done some incredible work in measuring underserved communities, African American, Native American, military veterans, et cetera. But what they hadn't done is realize that all of those communities can also fall under the umbrella of LGBTQ. We represent every demographic on Earth. And taking that sexual orientation and gender identity into account, they realized that this community as a whole has experienced systemic lack of access to care and also unique healthcare conditions, not just HIV/AIDS, not just STIs, STDs, higher rates of cancer because gay men and bisexual men smoke more, higher rates of chronic heart conditions because lesbian women typically tend to be a little more overweight. So we're trying to address some of these other issues. But what I found that they left out is because they are the NIH, they didn't say, oh, by the way, there's systemic discrimination from within the medical community itself. So we're addressing that unspoken issue head on so that people don't have to ask each other, where can I find a doctor that I feel comfortable with? And it's not finding a gay doctor or a trans doctor or a bisexual doctor. It's finding a doctor who's been scientifically trained to create a safe space in which you can be your authentic self and receive the care you deserve.